All right, well, thank you everybody for coming out. My name is Andrew Mertens. I'm with Iowa for Healthcare. Since 2002, Iowa for Healthcare has been fighting for the hundreds of thousands of people in this state that go every day without health insurance. They're not the only ones suffering in this nation's healthcare crisis, not by far. There are so many Iowans and Americans that have health insurance but are feeling the burden of skyrocketing healthcare costs get heavier every year. The cost of insurance is keeping America's big business from competing globally and are now keeping America's small businesses from even surviving. As you will hear in the Access Project report, Iowa family farmers, whose products we greatly depend on, are feeling this pinch now worse than ever. Years ago, a farmer might have to sell a piece of his land to pay for medical care. Now he'd have to sell the entire farm. It is inexcusable that in the richest country in the world, so many people can't afford access to health care. The American healthcare system is in need of real comprehensive reform, and this change needs to happen at the national level. Today we've released our presidential candidate healthcare plan comparison to our 32,000 healthcare voters in the state, and asked them to get out and caucus for healthcare reform, to caucus for the candidate that they think will have the best plan to bring quality, affordable healthcare to every man, woman, and child in this country. The longer we wait, the worse it's going to get. We must act now. We must reform. We must make reform a reality. I'd like now to introduce Bill Latero from the Access Project, and he's going to talk specifically about the data from the Access Project Farm Brief.
Thank you, Andrew. Good morning, everyone. As Andrew mentioned, my name is Bill Latero. I'm Field Director for the Access Project. The Access Project is a national research and resource center to help communities understand the details of the healthcare issues that they face and to offer policy suggestions and improvements that they can use to grapple with their local situation. In 2007, the Access Project joined with the University of North Dakota Center for Rural Health and Brandeis University, who we are affiliated with and partner with in all of our studies, to gather data about the source, type, and characteristics of farmers and ranchers' health insurance, as well as the financial burden that health care expense places on farms and ranch families. This was a sampling of over 2,000 farm and ranch non-corporate family farms across the Great Plains states, including Missouri. Today we're releasing an Iowa-specific report. Next week we will release the entire aggregate report of this second issue brief. For the Iowa study, it represents about 13% of the total 2,000 family farms, and of those family farms across Iowa, 13% is a sizable percentage of the total study. Key findings from that study include that farmers and ranchers are burdened with the cost of health care. More than 1 in 6 said that health care expenses contributed to financial problems. More than 1 in 8 had outstanding medical debt, that is, bills not paid. As we know, when bills are not paid, it mars your credit. It affects your ability to secure adequate loans at good interest rates. Additionally, Iowa farmers spend, on average, $6,500 per year for healthcare costs. But the story goes on. More than half, 59%, had household incomes between $40,000 and $100,000. They are not poor people. They are hard-working, middle-class Americans. We thought that this study would be very important because, in fact, it would reveal that the issues of the affordability and effective coverage of health insurance in the United States is not simply an issue for the poor, but in fact is an issue for middle-class families, hard-working farm families. And that of that middle-class family, you're having a problem where 7 to 16% of their income is going to health care. that's simply unsustainable. Farmers, if they want to farm, have to stay on the farm. Farm family spouses often go off farm for employment. Many of them are doing so simply to secure health insurance. So we looked at the differences between where did they purchase that health insurance. 37% when they want to do real farming and stay on the farm have to buy the most expensive insurance there is because they have to purchase it on the individual market. And that means they're spending far more than that average of $6,500, but more to the tune of $10,500 to be able to stay on the farm and work that farm. If we control for age and health status, farm families who got insurance on the individual market spent $3,609 more for health care coverage on average than those who got insurance through government-sponsored programs, as in veterans programs, or $3,947 for those who obtained it for having a spouse work off-farm. So it really inhibits the ability for them to stay on the farm, continue farming, and have a productive venture. More than one-third, So policymakers must consider these facts, because if the cost right now is ranging between from 7 to 16% of their income, and we know that healthcare costs are increasing annually, this is simply unsustainable. That means that next year it will eat up a larger percent of their total income. So this is a train wreck, and we need to be asking for our presidential candidates, our policymakers, to be considering real solutions that get at cost containment, that offer value products at a reasonable price. It's not what's happening, and it is what it needs to happen. Thank you.
Yeah, thank you all for being here today. Special thanks to Senator Frazee for coming. Really appreciate it. And I'm president of Iowa Farmers Union. I farm up by Clear Lake. And I guess to be brief on this, the healthcare system in this country is way beyond a mess. It's a disaster. It's broken. Especially for small town, rural America and family farms. When you got to go out and acquire insurance in the private market, individual market, we basically have two choices. Not having insurance or paying a very high price for it with a very high deductible. And what has happened to our family throughout the years, we've went without insurance at times, we've had insurance at times. It all depends on the economics of the farm. And as you get older, you feel like you kind of need the health insurance, because bodies, when they get older, they break down a little bit. And I guess my place in this is right now I'm in between insurance. I had to go on, again, insurance companies love healthy people, and as you get older, they find ways to get rid of you, and that is by charging high rates, especially the type of insurance we got to go out and get, or finding an illness that they can throw you out. And I'm a prime example of that. I'm type 2 diabetic. And so now my only choice is the Iowa plan, the HIP one, and at $1,000 deductible in January. It goes up to $517 a month. That's my insurance cost per month.